Assalamualaikum and hi everyone, my name is Mohammed Rakim bin Zamaluddin. So my metric number is D 2018-108672. So my public speaking topic is mental health. Do you know what is mental health? Okay. So basically mental health is a state of well-being which an individual realizes his or her own abilities, can cope with the norm of stress life, can work productively, and is able to make a contribution to his or her own community. Okay, so in short, mental health include the emotional, psychological, and well-being, and it will affect how we think, we act, and we feel. Okay, so mental health is important at every stage of life, from childhood to adulthood. So many factors contribute to mental health problem, including first, biological factors such as gene and brain chemistry, and second one is life experience such as trauma or abuse, and the third one is family history of mental health and problem. Okay, next one is mental health and wellness. Positive mental health allows people to first realize their full potential, and the second one, cope with stress of life, and the third one, work productively, and the fourth one, make meaningful contribution to their communities. So the next one is common mental health disorder. Based on our research, there are three types, which is the first one is anxiety disorder, and the second one is mood disorder, and the third one is schizophrenia disorder. Let's proceed.
Anxiety disorder. According to the Anxiety and Depression Association of America, anxiety disorder are the most common type of mental illness. People with this condition have severe fear or anxiety, which relate to certain object or situation. Most people with an anxiety disorder will try to avoid exposure to whatever triggered their anxiety. Example of anxiety disorder include first, generalized anxiety disorder (GAD), and panic disorder, phobia, obsessive compulsive disorder (OCD), and post-traumatic stress disorder (PTSD. For the next one is mood disorder. People may also refer to mood disorder as affective disorder or depressive disorder. People with this condition have significant change in mood, generally involving either mania, which is a period of high energy, elation, or depression. Example of mood disorder include major depression, bipolar disorder, seasonal affective disorder (SAD). And the last one is schizophrenia disorder. Mental health authorities are still trying to determine whether schizophrenia is a single disorder or a group of related illness. It is a highly complex condition. Signs of schizophrenia typically develop between the age of 16 and 30 years. According to the NIMH, the individual will have thought that appear fragmented, and they may also find it hard to process information. Schizophrenia has negative and positive symptoms. So for positive symptoms include delusion, thought disorder, and hallucination. For negative symptoms include withdrawal, lack of motivation, and a flat of inappropriate mood.
So the next one, I want to talk about the treatment, okay? Like how we want to treat these people to being a normal person, okay? So there are various methods for managing mental health problems. So the first one is psychotherapy or talking therapy. It can help the people to understand the root of their mental illness and start to work on more helpful thought, which is we can give them some motivation to improve their confidence level, to decrease their mental disorder, okay? So the next one is medication. Well, I think medication is a good treatment for those who have a mental problem, because I think when they get their medication, and it will help them to being a normal person like that. Okay. The next one is self-help. Okay, self-help. People with conditions such as anxiety or depressive disorder may benefit from relaxation technique, include deep breathing, meditation, and mindfulness. Okay, or the last part is conclusion. Okay, so the conclusion is, if you guys have all these symptoms, you guys have to do some tests from hospital to ascertain whether you guys have a mental problem or not. Okay, because it will give a bad effect to a person in the future if they not cure this from beginning. Okay, that's all from me. Thank you.